As we reported this morning, sadly, we had our second death of a North Dakotan related to COVID-19. This was a woman in her 80s from McHenry County, who had underlying health conditions and had acquired COVID-19 through community spread. We announced that this morning just before 10 o'clock. I'm equally saddened to report this afternoon that a third North Dakotan has passed away from the COVID-19 disease. This was a man in his 70s from Morton County. He too also had underlying health conditions and acquired COVID-19 through community spread. Community spread means it was not directly identified back to having contact with someone who had traveled from another area. This reinforces 2 points. One, the sad fact that this is a deadly disease. We had a one-on-one phone call this morning between officials in North Dakota, Lieutenant Governor Sanford, myself, and others, and with Dr. Birx, who is one of the medical leaders at the White House driving this. And again, we had a good discussion about how this is different from the flu. And one of the ways this is different from the flu, the traditional flu can affect younger people. This coronavirus is particularly lethal for people that are older or have underlying health conditions, and in her words, could be up to 15 times as deadly for people that would either be in those age categories and have underlying conditions versus the flu. And the flu is something that we have to be worried about every year, but this is something that's more serious.